So this week I'm going to be talking about the new assistant in medicine job that is now coming across New South Wales and more of Australia. I'll be talking about the who, what, when, where, why. I'll be talking about what it's like as an assistant in medicine, like a day in the life of an assistant in medicine. And also, I'm going to talk money. If that sounds interesting, then let's roll the intro. Boom! So the assistant in medicine job is also commonly talked about as the AIM position, okay? The assistant in medicine, AIM. Now, it's currently in a trial phase, but if it works out well and us students in the first wave don't screw it up, then it's probably going to be here to stay. So why are they trialing it? Well, basically, in March, we were seeing an exponential increase in cases in Australia of coronavirus, March, April-ish, and essentially a bunch of money just flew through from the federal and state governments into the healthcare system. And part of that money was to create a surge workforce, okay? We needed more workers. Now, there's lots of different ways of increasing the surge workforce in healthcare, but an untapped potential was the final year medical students, of which I am one, and using them to formally assist the medical teams in the hospital. So normally as medical students, we do this anyway because it's part of our training, but usually we leave at about 2 p.m. in the afternoon or earlier, and we do the things that are interesting and fun to do. So things like taking bloods and doing cannulas and all that sort of thing. We would rarely do like writing up documents and discharge summaries because it's kind of not interesting. And it doesn't really help us learn much, and so the teams wouldn't really force you to do that kind of stuff. But as there was an increase in COVID cases, it was looking like the workload for the healthcare teams, the medical teams, was going to be too high for the junior doctors to kind of handle by themselves. So they've put through some money to fund these assistant in medicine positions. The reason the money flew through in March is because we thought that the first wave was going to be horrible and the hospitals were inevitably going to be doomed, and the positions only really started in July. We didn't see a really exponential first wave because of really good policy and a bit of luck that Australia had in controlling COVID. But now we're flirting on the start of a second wave. We've seen Victoria having an increase in cases, but New South Wales might be following behind. So having the assistant in medicine students in as a trial might actually not just be a trial, but actually might be a proof of concept. So that's why it exists. But I know what you're thinking. You're thinking, how much do we get paid? Well, we get paid 75% of an intern's hourly rate, okay? So that's pretty fair to me. That sounds great. An intern gets about $70,000 a year. They work 38 hours a week. So if you work it out for their hourly rate, it works out to be about $38 per hour. So 75% of that works out to be almost $29 an hour. And so that is the rate of pay for an assistant in medicine, which I think is really good. Also guys, if you are finding this content interesting or informative, please consider subscribing. I would love for you to be one of the early bird subscribers. I'm a small channel, but absolutely love YouTube and will be doing this long term. So join me for the ride. And you can always unsubscribe later if you change your mind. So as a medical student, what is it like to be an AIMS? Well, it kind of depends what team you're with, but for me, I'm with the geriatric team, and the shift starts at 8. I usually get in at about 7:30 a.m. and start reviewing different patient notes. When I'm reviewing the notes on the electronic medical record, I'm looking at basically, one, how their observations trended overnight, make sure that no one became tachycardic, which is a high heart rate, tachypnic, which is a high respiratory rate, or hypotensive, which is a low blood pressure. Each of those three things would make me very concerned. And I also look at their temperature, although in the elderly, a lot of people can have infections and not develop a fever. After that, I look at the different notes that the other healthcare professionals have put into the system. I'm looking at what the nursing staff recorded overnight. Was the patient agitated? Did they have diarrhea? Have they had trouble sleeping? These are all really common things. And I also look at the notes from other allied health. So has the physiotherapist come to see the patient and do the physiotherapist think that they're at their baseline ready to be discharged? Has the social worker organized services in the home so that the patient can be discharged safely? Those sorts of things are really important for the medical team to be up to date on. Because you can't go home if the allied health haven't given you the tick of approval. And a final thing I always have to check as the assistant in medicine is, when was the last time they opened their bowels? Constipation is a huge issue in aged care. A lot of the patients aren't that mobile. They might be on opioid analgesia, and that'll often cause constipation. So we do that up until about 9 a.m. when we start our ward round. And the ward round basically includes me, the junior doctor, and a senior doctor, and we get a mobile computer and go to each patient. Currently, we have to wear masks near patients, and there are three main things that we do when we go to a patient. We ask them how they're going and what the update on their medical situation is. Do they need anything? How's the pain going? That sort of thing. We examine them to listen to their chest, make sure there's no fluid in their lungs, but listen to their heart, feel their abdomen, feel their calves, to make sure there's no kind of signs of tenderness in the belly and there's no signs of thrombosis in the legs, because developing clots when you're lying in bed all day is a very common issue. While one doctor will be doing the examination, I'll usually be taking notes, and another doctor will be on another computer, probably doing orders, so ordering medications or stopping medications or ordering investigations like a chest x-ray if they need one. So those are the three roles, but sometimes we switch between the three roles. So I might examine the patient while one of the junior doctors types and the senior doctor orders, or something like that. After we see all the patients, we usually develop a list of jobs. Now there's a wide variety of different types of jobs. Common jobs that I have to do as an assistant is calling the GP to chase up the history of certain medical conditions of the patient. I have to put in cannulas, take blood cultures, take blood tests. I have to help with writing discharge summaries. And then it can be all sorts of other weird and wonderful things. Just the other day I had to do a parectal exam on someone who was having a iron transfusion. So those are the kind of jobs that you would do. And sometimes you do those jobs during the ward round or after the ward round. And then depending on what team you're with, you usually finish at either 4 or 4:30 p.m. in the afternoon, and then you can go home. It is really tough to study after a day of being an assistant in medicine because it's a new job, and there's just a lot of learning. You're quite cognitively exhausted by the end of the day. So I rarely actually study after an AIMS shift, which is pretty hard. But sometimes you have to, like sometimes I have to skip lectures to do the AIMS shift, and so I have to catch up with the lectures at night. So that leads in well to the next question, which is how does it balance with medicine? Because we are still medical students. It's pretty interesting, right? We're medical students under the university for 3 days a week, but then for 2 days a week, we're actually employees of the hospital with a university relationship. And so you start to realize just how many stakeholders are involved in things in healthcare, and it's ridiculous numbers of stakeholders. So the week before starting as an assistant in medicine, we were getting emails from so many different administrators. There was the general university administrator, the phase 3 administrator, the course administrator, psychiatry administrator for the hospital, and then the psychiatry administrator for the placement, which was not in the hospital. Then we were getting emails from the university of supervisor for the AIMS, but then the hospital supervisor for the AIMS, then the general workforce from the AIMS. We were getting all these different administrators all sending emails being like, in bold and in red writing, make sure you read this carefully. And then they would make mistakes and they would organize things that conflicted with each other. It was just really, for me, a bit of a nightmare to kind of follow. So yeah, it's 2 days a week in the AIMS and 3 days a week in the uni role. And it depends what course you're up to. I'm in psychiatry, and the psychiatry have said that you have to do at least 20 hours a week in your placement, which you can do in 3 days if you do 7-hour days. And then all the examination for the medical course is the same. So you still have to do the same amount of exams and assignments and observed clinical stuff that the other students in your course would do. They've been pretty good about it and said things like, if the AIM shifts are conflicting with any of the assessment or exam times, they'll change the exam times for us. So that's nice and supportive. That's good to hear. It's important to remember that this isn't a new idea, right? Like, there have been assistants in nursing for years and years. So we're just following a model that we know works. So in my opinion, it's a really good idea. It upskills students. We do help. I've gotten that feedback from the team. I've had really positive feedback from the team, so they are grateful that we're there. But I guess it's still yet to be determined whether this will be an ongoing thing in the future, but we'll see. Okay guys, that's it from me for this week. If you have any questions, just comment below. I'll answer all the comments. And of course, have an absolutely lovely day. Bye for now.